Thank you.
Can you tell us a little bit, Betty, what is behavioral health or mental health?
Behavioral health and mental health they're kind of trying to combine that and use it interchangeably. Mental health is our emotional state, the emotional health state that we're all in. And behavioral health is the other aspect of health, how we want to be. Surround yourself with positive people, what you need to do to have a stable mental health. You want to make sure you're sleeping right, make sure you're eating right, make sure you're exercising. And all those things combined can help improve our mental health. So that's what that is.
Can you maybe give us some signs and symptoms that family members, coworkers, friends, anybody that could watch for with somebody that may be experiencing some type of emotional or behavioral health type of an issue or problem?
Yeah, there are some symptoms that family members may notice. They may notice that sometimes the person they love all of a sudden quits wanting to do the things they normally enjoyed. Or they realize they're not sleeping very well at night, or they realize that they're not laughing anymore. And maybe in fact you found them crying and they won't talk to you about anything. Possibly they've quit eating, or they've started eating a lot where they're binge eating to try and cope with their stressors. Others lose weight, quit eating altogether. Feeling like they don't know what they want to talk about, or they're feeling like they're confused a lot, and you're like, you're thinking to yourself, what's wrong with you? Mm-hmm. Those are some of the symptoms that would send a red flag that maybe there's something going on with this person that I love that needs to be addressed.
What would you say, those are great symptoms that you recommend to watch out for. What would you say that people should do if they're seeing this in their loved one? What should be the next steps that they should be taking?
I think they need to talk to the person that they love, that they've noticed something, and ask them if there's something wrong. I would go to that person directly. And if they're willing to talk about it, and a lot of people sometimes are, surprisingly. Yes, you'll have your few that don't want to talk about it because it's, maybe you're a person that they have a guard up to start with, or they don't want you to worry about them. So they stay back and isolate and they don't tell anybody anything. But then if you could at least encourage them to go get some help.
Sure.
And, mental health is important for everybody. And the stigma of mental health needs to be gotten rid of, because we all have our own emotional and mental health that we have to deal with, and it's a real thing. And the better way that we take care of ourselves is the better that we're going to feel and be able to help people we love.
Definitely good points. What services, Betty, do you provide here at the clinic that you can just give us an overview regarding?
I do med management for all mental health problems: anxiety, depression, ADHD, PTSD, trauma, bipolar illness, schizophrenia, alcoholism. We help them with that. A lot of people have trouble with that, and we find out that they're self-medicating themselves with alcoholism. So we try to help them with that here too. I do a little bit of therapy, but I have a partner, Megan, here that can take over when we need more time with people. So,
thank you, Betty. That was a lot of good, useful information and very helpful. So thank you very much, and thank you for being a part of our clinic team. And now we're going to take some time to introduce Megan.
Okay.
Thanks, Betty. And for more information on our behavioral health clinic, you can go to our website at www.unitypoint.org and check out our behavioral services on our website. So hi, Megan. How are you?
I'm good.
This is Megan Sutton. As Betty had alluded before, Megan is our counselor from Hillcrest. We partnered with Hillcrest. It's been probably just about a year now. So we're excited about that partnership, and you're definitely starting to see some growth in counseling services for our patients. And Megan does counseling services for patients at our primary care locations. So if you do see one of our primary care providers and they feel that you need a referral for some counseling, or even to see Betty initially, we can get those referrals set up right here in our clinic, and you can come back to the clinic the place where you're comfortable coming and seeing the staff as well as our providers, and Megan can do those services right here at our clinic. So Megan, why don't you give us a little bit of an overview just about yourself and your background?
Okay. Well, I grew up in Dubuque. Went to senior high, graduated from Loras with a degree in psychology. And then I took some time off and had a family, and then went back to school and got my master's degree in counselor education. I was a school counselor for several years, and then we moved out of state for a while, and now I've come back. And I'm a licensed mental health provider here in the state of Iowa.
Good. Well, thank you for that, Megan. In regards to mental health counseling, can you maybe describe some of the benefits that for patients that do come to counseling?
Well, I think some of them, I think a lot that Betty said was true. Our minds and our bodies are interconnected with one another. And one of the benefits from counseling is that if you're under a lot of stress, if you're under a lot of, if you're having depressive symptoms or anxiety symptoms, that impacts your personal physical health as well. Yep. So one benefit that the patients might have here is that they can, have that contact with their primary care providers, and then they can also kind of deal with those stressors and those life situations that may be impacting their health.
Yep.
So,
what should a patient talk with their primary care provider about if they feel or they think they need counseling? What type of things should they be bringing up to that PCP?
Well, I think, once things kind of start impacting you on a daily basis, like we all feel down at times, we all get a little bit anxious at times, but if you're experiencing those things on a daily basis and they're starting to really impact your life, like not being able to sleep, or having a lot of anxiety about going to work, or you're having relationship issues that are impacting your moods, or maybe you've lost a job, or you've Betty talked about trauma and grief, maybe you've lost a parent, and we all go through that. But if these things are impacting you on a daily basis and they're really starting to impact your life, that might be a good time for you to have a discussion with your primary care physician, saying, I just have a lot of stuff going on, and I'm feeling down and I can't get out of bed or whatever. And then your primary care physician can hopefully, refer you to some help with, whether it's Betty or refer to Hillcrest to kind of help you kind of get that out and externalize that so it doesn't impact you in such a negative way.
Yeah, I definitely think that's a good idea. Can you tell me, Megan, what ages do you see for counseling services at our primary care clinics?
I usually see adolescents, and then pretty much any range of age range after that, but mainly adolescents through middle age. I provide services for older individuals as well. So, and with a lot of different diagnoses. I have experience with depression, anxiety, grief and loss, trauma, pretty much all of those things I've had experience with providing services for those diagnoses as well.
Good. Well, thank you very much, Megan. I appreciate your time here today. And again, like I had talked with before, it is very important to, if you're having any types of these feelings or thoughts or behaviors and you're not able to cope with those, it is a really good idea to talk to your primary care provider. And we do have our primary care clinics located in Cascade, Piasta, and here in Dubuque, so you can establish and set up appointments with those providers, talk to those providers, and they can coordinate care with either Betty or Megan to help you out in these types of situations or what you're going through. So again, thank you, Megan, and thank you to Betty as well. And thank you for joining our Facebook Live. Again, if you have any questions, you can go on our website at www.unitypoint.org/Dubuque. Thank you.